When you think about a heart attack, what comes to mind? Crushing chest pain, shortness of breath, left arm pain? Many people think of heart disease as a man's disease, but heart disease is the #1 cause of death for women in the U.S. What is it about heart disease that's different in men than women? How can you recognize the warning signs? Stick around and I'll let you know. Have you been feeling a lot more tired or fatigued lately, and you don't know why? Did you think, this could be my heart? Did you check with your doctor or seek urgent care for these symptoms? How many of you blew these symptoms off? Maybe you're always tired because you're running from work to kids to ball practice or rehearsal. You're rushing to get home to fix dinner. Maybe you ate something that didn't agree with you. Maybe you overdid it at the gym and your neck or your arms sore. Maybe you have trouble with hypoglycemia and you get dizzy. But those symptoms, indigestion, neck pain, dizziness, fatigue, all are symptoms of heart attack in women. And in some cases, those symptoms will show up weeks before the heart attack. But don't panic. I'm going to put it into perspective for you. Do women have the classic symptoms of chest squeezing or tightness like men do? Well, yes, they can. But your symptoms may also be more subtle. That makes it really important for you, if you're a woman, to recognize the symptoms that can occur and get medical care when you need it, especially if you're at high risk. As I said, the classic symptoms that people associate with heart attack is mid or left chest pain or pressure that comes on gradually over several minutes and then fades away over the next few minutes, especially when you're resting. Notice I said pressure and not pain. Women can have a high pain threshold and don't perceive their symptoms as pain, so they say, oh, it's nothing. But they may just feel like something's wrong. Well, if you feel like something's wrong, don't ignore it. One of the first things I ask patients is, how long have you had the symptoms? If you've had the symptoms of indigestion, chest pressure, dizziness, but it's been going on for months and months or years, it's less likely that it's a symptom of a heart attack. On the other hand, maybe you've had symptoms and now it's gotten much, much worse lately. Well, that's the time to seek medical care. I once saw a man who came into the emergency room because he was having indigestion, and it was a lot worse than he usually had. It turned out he was having a heart attack, and he went into cardiac arrest right there. If he hadn't been listening to his body, he would have died that day. So a new symptom or something much worse than usual is a red flag that should alert you that you need to seek medical care. That doesn't mean that it will be something terrible, but it's better to be safe than sorry. So number 1, listen to your body. If you've been feeling perfectly fine and then all of a sudden you've started having fatigue or vague symptoms, don't ignore them. Be aware of the warning signs. Women are more likely to experience fatigue a couple of weeks before a heart attack. The shortness of breath and chest pressure or pain may not occur until they're actually having a heart attack. That's another reason why regular exercise is something I always recommend. If you've been able to walk a certain amount and all of a sudden you can't walk up that same hill or you can't walk as fast as you did before, then that's a sign that you should see a doctor and have things checked. As a doctor, I want to know what has changed and when or how it's changed. So listen to your body and notice those changes. Don't ignore them. Next, know your risk factors. How's your weight? Are you overweight or obese? What about blood pressure? What about your cholesterol and sugar? Do you have diabetes? Do you smoke? Smoking is one of the biggest risks when it comes to vascular and heart disease, and I always encourage people to quit smoking. And then there's things that are harder to put numbers on. What's your family history? If everyone in your family lives to be 100, then that's great. You may have won the genetics lottery. But if many of them are having heart attacks or stents in their 40s and 50s, then you should be proactive and do things so that you don't follow in the same footsteps. What about stress? Are you under constant stress or do you react poorly to stress? I've seen time again and again where women spend so much time taking care of family members and being a caregiver that they neglect their own health. What about your diet? Do you eat lots of processed, pro-inflammatory foods and vegetable oils and sugar? Or do you eat more fresh fish, fresh foods, and vegetables? Do you exercise regularly? Not only is exercise good for the heart and weight and blood pressure, but as I mentioned, it helps you to notice if something has changed. If you are at increased risk, work on the risk factors you can. Consider asking your doctor to order a calcium screening, check your cholesterol, check your blood pressure and sugar regularly. Even if you're in your 20s or 30s, get established with a family physician and have blood work. Get a baseline EKG. Discuss your risk factors. My take-home message to you, listen to your body. Know your risk factors, work on the risk factors you can, and don't ignore when you have symptoms. Remember, if you have the symptoms in a cluster, fatigue, dizziness, neck pain, jaw pain, indigestion, pay attention to those, and it could save your life. Thank you for watching, and be well.